Well, it's breaking news that we've been following this evening. A CDC advisory panel has just ruled on whether the Johnson & Johnson vaccine should return to the market. It's been 11 days now since it was paused because of a rare blood clot condition found specifically in women. That committee deciding to resume that vaccination process here. Washington correspondent Raquel Martin live in D.C. Raquel, tell us, how did the panel vote today?
Well, it was a 10-4 decision to recommend the reauthorization of the Johnson & Johnson vaccine, but we know that this isn't a binding recommendation. We know that the FDA and then the CDC director must also approve it for it to get back online. Friday, health experts on the CDC advisory panel poured over pages of new data evaluating if the Johnson & Johnson vaccine should return.
The model predicts that 26 cases of TTS will occur among the 9.8 million persons vaccinated, and that about 2,200 deaths and 1,400 ICU admissions would be prevented.
In the meantime, the White House says it's planning to step up its effort to get millions of more people vaccinated.
We have less of a supply issue. We have more of it's incumbent upon us to reach people and meet them where they are.
We are laser focused on educating the public.
At a White House COVID response briefing Friday, lead coordinator Jeffrey Zients seemingly acknowledged after weeks of steady vaccination daily numbers, the nation saw a recent dip.
Going forward, we expect daily vaccination rates will moderate and fluctuate.
He says the administration is pouring millions of dollars to reach people less eager to get vaccinated,
including encouraging walk-up availability and providing transportation options.
I am concerned.
Illinois Senator Dick Durbin says he hopes new investments work.
We are starting to see a slowdown in the number of people who are showing up for vaccines.
And says people should get the Johnson & Johnson vaccine once it's back online.
We're only at the halfway point. We dramatically need to increase the number of people who are protected by vaccination.
Before today's announcement, the CDC director was asked about the Johnson & Johnson vaccine. She said she didn't want to get ahead of the announcement, but has already said that she believes that the Johnson & Johnson can be a more convenient option for people looking for a single dose. And when asked when she would be able to approve it, she said she would want to move quickly. For now in Washington, Raquel Martin, back to you.
Raquel, thank you for giving us the latest there and what's going on in Washington, D.C.